I'm Michelle Collins, certified nurse midwife and professor of nursing at Vanderbilt University School of Nursing. And today we're talking about treatment of yeast infections during pregnancy. Pregnant women are particularly at risk for yeast infections because of the hormone estrogen that's produced abundantly during pregnancy, which increases the amount of glycogen in the vagina, which is a type of sugar that yeast like to thrive on. And so pregnant women may notice signs and symptoms of a yeast infection, which include vaginal itching, burning, discharge that may be very clumpy and whitish to yellowish to sometimes a hint of green. It's most important if a woman feels that she has a yeast infection to check with her midwife or her physician to make sure of the correct diagnosis, because there are other infections that may mimic the symptoms of yeast and that may put her at risk for preterm delivery. There are many treatments for yeast infection during pregnancy. Most providers will use vaginal creams, either over the counter or something that they may prescribe for you. Some other things that a woman can do if she has a yeast infection or to prevent it are to wear cotton-crotched underwear and not nylon or synthetic blend underwear, and even go without underwear in the nighttime so that airflow can get to that area. Remember, yeast love to live in warm, moist, dark areas, and so we want to get airflow to that area when possible. Also, when she gets out of the shower, take a blow dryer, set it on a cool setting, and after towel drying the perineal area, just lightly go over with a blow dryer, and that will help get the skin as dry as possible, again, so yeast won't be able to grow there. Change out of damp clothing like swimsuits or exercise wear that may be sweaty as soon as possible so that there's not moistness in that area. No douching. Always wipe front to back after urinating or using the bathroom. Try to decrease high sugar foods or high carbohydrate foods in one's diet, and don't use any feminine deodorant sprays, bubble baths, or any type of perfumed lotions in the perineal area. And there is some literature that notes that adding more yogurt or acidophilus cultures to one's diet may be very helpful in treating yeast. There are other complementary types of treatment, and you'll want to discuss those with your midwife or your obstetrical provider.